Welcome to another episode of Let's Talk Small Data with T, where we are passionate about the power of small data in healthcare. I am your host, Tanazia Gonzalez, but you can call me T. Data has certainly changed the game in healthcare. Big data has blown the roof off, but small data, now that's the future. Small data allows us to dive deep into the key insights and take quick, customized action to achieve phenomenal results in performance and quality improvement. Let's explore this today. Thanks so much for joining us. If you have any questions for me or any of my guests, feel free to reach out to me at tgonzalez@eima-inc.com. Enjoy the show. Let's go. Welcome to Season 2 of Let's Talk Small Data with T. We ended Season 1 with a bang. We had 17 episodes published, over 1,550 Instagram followers, over 470 views on YouTube, and over 411 audio downloads across 6 continents and 25 countries. That's right, we are global, and the numbers continue to rise today. We explored the power of small data and several topics, including health literacy and equity, the HIE, cybersecurity, life sciences, and so many more. We are kicking off Season 2 today with a topic near and dear to my heart, being a mom of 3 growing boys. I am honored to have Dr. Max Derenoncourt joining us from Portland, Oregon, to talk about small data and child and youth mental health literacy and support. Dr. Derenoncourt is the CEO of the mental health consulting firm called Max4Health Inc., and he's the COO of the public health consulting firm called Derenoncourt Consulting, LLC. His work revolves around increasing population mental health literacy and focuses on increasing mental health support resources available for children, particularly from minority and underserved communities. I'm so excited to kick off this season talking with Max Derenoncourt. Thanks for stopping by, and I hope you enjoy the conversation as much as I did. Dr. Max Derenoncourt, welcome to the show. I'm going to start your video and ask you to join us. There we are. You should be able to welcome to the show.
Thank you.
All right. So happy to have you here. Thank you for agreeing to join me and talk about the programs that you have going on in your practice and how you all are using data to serve the population that we both hold near and dear to our hearts. So if we can go ahead and just take a few moments to talk about you, a little bit about your background, that would be awesome. Where are you coming from again?
Yeah, absolutely. I am joining you currently from Portland, Oregon, which is where I'm based and where I work as well as do research. I transitioned out of clinical practice, so currently I have a public health practice, which is what I'm here to discuss. Public health in terms of, looking at population metrics, obviously child and youth population metrics in terms of mental health is very important to me as it is to you. This is where I'm based. I am affiliated with the OHSU-PSU School of Public Health, which are 2 important Oregon institutions. And I also do some program development and implementation, training organizations in providing support to their communities. Full disclaimer, I also work on the adult side, so I do both adult work and child work. My research and advocacy is very specifically tailored to child and youth mental health.
Interesting. That was actually going to be one of my questions. What is the difference and why do we need the 2? I was just curious about your thoughts on that.
Yeah, absolutely. Obviously, especially since the start of the pandemic, we have come to understand even more that mental health is very important and is a part of everybody's everyday life. Why do we make a distinction between adult and youth mental health is mostly because adults and children and youth, which are older children, I suppose, have a different needs in terms of what their mental health is made of and what it takes for them to, I'm talking difference between adults and kids, and what it takes for them to be at their best, both mentally and physically, in order to be fully functioning members of society. That's why we make the difference.
Yeah. I mean, it seems like a kind of obvious answer as I was asking the question, but I just wanted to have you speak to that for a little bit, just in case there are folks in the audience that are saying, why do we need to separate the two? So I can understand, being a mom of two preteens, I know they definitely have specific things or issues that are different from mine and other folks. So
the example that I want to give is, and I'm going to bounce off of your example. If you think about your life, you wake up in the morning, you take care of your kids, probably take care of yourself as well. You probably think about work and go to work at some point. And then you also have your life that is outside of work and outside of your family. And, it could be, doing arts, going to, I don't know, dance activities, any number of things that might make you feel well. But then you shift and think about the structure in your kids' life, and it might look very different. It might, when they wake up, they might start thinking about school and what they need to do to perform well that day. Their day probably shorter than yours. You probably work longer hours than they do. And when they come back from school, they probably have a different set of activities that they think about. They probably think a lot about social media. They probably think a lot about interacting with their peers. And that really creates a different dynamic. And also bearing in mind that adult brains and child and youth brains are different. So that leads to thinking about the world and space and your life really in different ways.
Wow. Yeah. No, interesting. Listen, or like when we say child versus youth, what age groups are we talking about with those two groups?
Yeah, absolutely. So I'll just break it down in general terms. But if you think a baby would be less than a year old, a toddler between 2 and 4, you get to childhood really when you're school age about, and then you move into preteen years, teenage years. So we're talking about anything from 11 to 20 would be considered youth. And could be extended all the way to 25, 26, 27, as you've probably heard that the brain doesn't really fully mature until you're about 25 years old, and that's because your prefrontal cortex, the part of your brain that thinks about judgment and is able to make rational decisions, it just takes a long time to develop because those circuits are really wired in an intricate way that takes a lot of time to solidify. So which is why we think about the world differently, because again, the brain functioning is quite different in those age groups that I just outlined.
Makes sense. So in your work, are you more focused on one group over the other, or pretty much equal amongst the two, child and youth?
Yeah, so I work a lot with organizations and schools that cater to children. So we're talking about school-age children, 4 or 5 to the preteen years. And then also equally with the youth population, these would be, preteens all the way to your late teens and even early adulthood. The difference for me is not about how I split my time, but more about how I think about the work that I do and what children need versus what teenagers need. I mean, a very simple example would be, I do a lot of work that is social media based. And internet based, or phone app based for teens. especially in terms of like the support that they can access and their level of comfort with technology. Whereas children either might not know so much about technology, even though they can learn very quickly, might not have the tools, or might require a lot more adult assistance. And then children also think about the world differently. So, for example, the way kids think about the way they socialize is very different from the way teens think about socializing. So teenagers tend to seek community a lot more than children who might rely more on their parents or care providers.
Interesting. Very nice. Yeah. And these folks are the people that will be running the world tomorrow. So thank you for what you're doing. So you're trying to make sure we have a more healthy tomorrow. So when we say mental health literacy, what exactly, and support, what exactly do we mean by those two before we jump into how you're using data?
Yeah, absolutely. I'll start with literacy, which mental health literacy is more about individual and community levels of understanding of what is mental health, what are the components of that, what affects it, and the flip side of that is, are you empowered with your knowledge to make decisions that will promote it, that will create a better individual? So if you think about, even for yourself, what do you know about mental health? What do you know about what goes into fostering good mental health for you? And are you able to use those key points of knowledge, data, to inform the way you go about your life in order to be the most, the happiest person that you can be, and the most productive as well.
Your best self.
Yeah, your best self, basically. So these two components, it's the same thing for children and youth, with some caveats, obviously different populations, but children do have mental health, and I just wanted to just put it on record. It used to be a thought that child mental health was either inexistent or not important. Both are not true. I mean, child mental health is a thing, and it's very important. And as you mentioned, we're building the people of tomorrow. So it's very important to sort of understand that they are people. They just are people that, feel and think differently and have different needs than adults.
Yes, they are human. Just like us.
After all.
They're just smaller, and yes, I understand that well. So I hear mental health and I hear behavioral health all the time. Are they one and the same? Are they different? What would you say about that?
They're part of the same family of what we understand to be important components of our lives. So mental health, if you think about the state of your being, how do you feel today? So what's your mood? What's your level of functionality? How much are you able to do today based on how you feel? And then leading to behavioral health, how does what makes you emotionally and physically today inform, how is that informing what you do today and how you choose to interact with the world, really? Like, what makes you wake up in the morning? What makes you, want to sit down with me at this moment? And same thing for children, but with different things.
Yeah, I mean, to your point before, where you were saying some folks were thinking mental health issues did not exist with children and youth. I heard something about, I think I read a recent CDC article where adolescent suicide was on the rise, especially with adolescent females, especially after Facebook and social media really became popular. Have you heard similar accounts? I mean, it's almost like, where are the companies that focus on stopping these suicides with our young persons? Because to your point, they have specific issues, and if there could be support that could step in, or they would know about the support and be encouraged to ask for help earlier, we could avoid that. So I'll stop there and let you respond.
Yeah, absolutely. So, and you're right. We have important data coming from the CDC, the Surgeon General, and organizations like Mental Health America, as well as the National Alliance on Mental Illness. Sort of confirming what we suspected, but is definitely the case, which is at this point in America, 1 in 4 kids experiences some form of depression, and 1 in 5 kids experience some form of anxiety disorder. We know that some of the wider spread mental issues that children and youth deal with are depression, anxiety, as well as substance use, especially as you move up, age categories. So mental, and the pandemic made it worse. It used to be bad, and now it's exacerbated. It's exacerbated by the pandemic. There are various national, statewide, and local initiatives to address that. But the key lesson is that child and youth mental health, well, 1 is super important, but 2 is it's in need of some sort of plan at the population level to address it. Otherwise, it won't be good for our kids growing up at this time.
Totally. And I think exposing this issue, talking about it, bringing folks together on venues like this, podcasts and panels and stuff, helps raise the awareness and put the call to action out there. All right, folks, we have this area, we need to improve it. So this is Let's Talk Small Data with T. Let's dive into some things or projects that you're using, where you're using small data, or I don't know, some success stories that you can share with us, or, different things that you're doing.
Yeah. I remember the first conversation we had, obviously not on this podcast, but to shed some light on it. The conversation we had on small data, which I think is a very interesting term, especially when you work in the field of mental health. And I will sort of add my own spin to it. I usually call what you call small data, I will call in my field community anchored data. So data that is usable at a scale for, organizations, community partners, schools, school boards, county leaders, state leaders, just to inform the way we go about programming, as well as our general understanding of how to build mental health support frameworks. So community anchored data I use in my everyday life. Obviously, I'm a consultant for many local organizations and government agencies. I provide training in mental health support. So we're thinking, mental health first aid. We're thinking about child and youth mental health first aid. We're thinking about school, mental health in the school environment, as well as mental health in the workplace. In my public health practice, I use, I generally do what we call community-based health assessments. And that is to discover, what's the extent of the need in the community, and if we're thinking about child and youth populations,
kind of a baseline and assessment.
So how is everybody doing? In the way people are going through their everyday life, do they have the tools to recognize their state of mental health? Do they have the tools to ask for help? And then when they do they have the support system that's able to help them bridge the gap between where they are and where they want to be?
Right. seems that it would take some follow-up and some tracking and monitoring. So when I think small data, I'm saying, we dive into the data to really track. Okay, here's the baseline. Here's where we are. Okay, we now have this individual in this program. Let's track some key metrics, keep a pulse on where they are, and we see it going in the wrong direction, or we're identifying what direction we need them to go in and tracking it against the target. We know if it's going well or if we need to pivot and make a change. So that's what I mean by like small data, diving into it really helps you take action and like stay on track and like move towards a goal.
Yeah.
So that's awesome.
Yeah, I'll give you an example. So I do some work with an Oregon-based organization that provides mental health support for kids with certain learning disabilities, as well as certain developmental disabilities. But one of the services that they provided pre-pandemic was peer support groups where just kids can get together and talk about their especially anxiety was pretty big. So we're talking about kids who all deal with anxiety in their day-to-day and talk about it and provide each other like tools to overcome it. Help them overcome it. Yeah, absolutely. Yeah. And pre-pandemic, attendance was quite low, and enrollment was low as well, just because the kids had to have their parents drive them to the place, interact physically with a lot of folks. Post-pandemic, that has been moved online, and attendance kind of skyrocketed.
Right.
Because it just became easier. It didn't involve a commute and involved interacting with technology, which in that age category, the youth involved were very comfortable with. So it ended up being, by happenstance, it really reached the target market or the target population in a way that they really wanted to be reached. And it really took a pandemic to get there. So the point is, instead of having to wait for a chance event to lead us to address some of the needs that we're currently seeing appropriately, let's think about and listen to and collect data on what the community is saying, in this case, the community of children and young folks, and try to meet them where they are.
Right, and like empower them. Come in and help us build, how to better serve them. Absolutely. So I love that, moving it online clearly improves access, right? It's just easier. And then if folks don't physically have to be there, they can just sit at a computer and even hide behind an avatar, but still be there and kind of hide and come out when they want. Gives them more control, right?
Yeah, and just to bring that point home, it's one of the ways in which adult mental health support and child and youth mental health support would be very different in this world. I would have, there are situations where adults are more, they're more interested in interacting live with people, just because if that's the way you were brought up and that's the way you are comfortable with interacting with folks, it's not a big deal. But with the current generation coming up, we're talking about Gen Zers and younger, it's a different demographic that thinks about the world differently, and we need
You have that generational element there.
The other thing that I use data for is to increase equitable access to mental health services. So we're talking about making support services available to communities of color. There's a report that came out last year, and I think NPR did a piece on it, stating, and it is true, that if every Black person in this country wanted to have access to a Black therapist, there wouldn't be enough. And that is because obviously there are Black therapists everywhere in the country, but not in large enough numbers to cater to the Black community. But same thing in the Indigenous community, and same thing in other communities of color. So the idea is to create resources that are available and accessible enough, aka think about issues with coverage, issues with where those services are being distributed. Obviously, communities with more resources have more access to more resources. So the idea is to think about equity issues in providing access to services. So, are Black kids in the country able to access telemental health services at the same rate? And that's part of sort of my advocacy, and I use these data points that I'm mentioning to sort of drag the point home at the community level.
Okay. So it's like, we're evaluating these statistics and we see where the issues are. Now what? What action do we take with that information and those data?
There are so many ways you could sort of dissect this issue. One is at the organization level. Let's say you are a school board, or an organization catering activities to kids. One simple way to sort of address that is asking yourself, one, am I providing mental health support to my community? I think a lot of organizations don't ask that question of themselves. And in today's world, it's become a very crucial question to ask. And two is, within my community, are there pockets of people who have less access to the services that I'm making available, especially in terms of mental health? So that's when small data could come in handy, because if you don't have the answers to those questions, okay, that's not a bad place to be. We can figure it out. And that's where a community health needs assessment becomes very crucial, because it lets you know where you are, and then it can drive decision making. That's at the organization level. I could talk about, how coverage wise and policy, but I think that would sort of we would step out of
we sit here talking about all kinds of stuff. So thank you, I appreciate that. Totally. So I mean, it takes a village for sure, but all of us coming to the table saying, okay, here's my thought, and then we come together and piece it into one picture. And that small data, it's really diving into that individual. It's really getting down to the individuals, and then letting your diving in bubble up to the community and the population. So very good.
I want to add one more thing. So another thing that is very important in increasing equity and equity within data is what we call community-based participatory research. And it's a big, set of words to say it's important to involve the community in the process of data. We're talking about procurement of data, we're talking about analysis of data, and we're talking about communication of data. It's important to involve the communities being talked about in discussions about themselves. I think academically we have been brought up in a world where schools, and I'm talking about universities, they do research, they figure out a whole bunch of stuff, and then the now what is kind of not really answered, and the data produced becomes irrelevant because it's unusable by the community, or it doesn't involve the community in a meaningful way. So the idea, especially with the pandemic and subsequent mental health crisis that came out of that, it's important to think about centering the community within your data. So engage the community, or even let them lead what data is important to them and how they want to manipulate it.
Interesting. So involve them in the process. Don't just talk about them and them over there. Bring them in. Let them be a part of it. That's very empowering.
So for adults, especially in communities of color, it would be, hey, how does your community approach wanting to provide mental health support? And honestly, So an example I could give is in faith-based communities, we can still have discussions about mental health, but especially in Black communities that are also faith-based, one of their forms of mental health support is based in faith-related activities. And that can be deemed as not reliable or important data, but one, it is important, two, it is reliable, and three, is the community has deemed that this is important, and that's some data that can be used to measure where you're coming from, as well as what the impact of, let's say, that particular activity, which could be faith-based, what's the impact that could have. That's for adults, right? But for, in youth and children, the discussion is a little bit different, but is no less important. For example, in youth populations, you will hear a lot, I want to be able to talk to my friends online. And if I can't do that, I want to be able to talk to a professional online because it's easier and it engages me better. And then another discussion is, youth might say, yeah, social media really impacts the way I see myself and the way I interact with this world. So that's other data points that we have. And if we center the community in those discussions, they will drive us to what is important and where we can make a meaningful difference.
Interesting, very interesting. Yeah, I'm just thinking in my head when you were saying, the youth telling us social media really impacts my thoughts about myself, and they might not even know that or realize it, that they're being programmed to think a certain way and feel a certain way, and you don't even know why that's happening. So having the right support in place to help them process that and really get to the bottom of everything and move on is really important. So thank you for the work that you do. Thank you to all of the mental health folks out there who are part of this tribe, all of us together trying to tackle this topic. It's really important, and we are actually at time. So is there any last words you'd like to share with the audience before we close out?
No, I mean, first of all, I want to thank you for having me, and it's been it's been an interesting discussion. I really love your questions and the way you think about mental health, as well as the sort of child and youth population, which is, not everyone thinks about child and youth mental health the way, professionals do. And two is, it's very simple, whether you're an adult or a child, ask of your community and community leaders for mental health support. If it's available, try to access it and try to improve it. If it's not, say, hey, I think it's important for us to talk about mental health and build a structure that is able to cater to our needs. I think that's an important step for everyone to sort of take, whatever your organization or community is.
Totally. I totally agree with that. And I would love to have you back on the show, maybe with some other folks. Also, maybe we can have a panel and just really dive into this community topic. It's really important. I've spoken with a couple of other folks who are doing some really important things for their communities around different topics, like food pantry, like solving for food deserts, and mental health and the vaccination inequity and vaccinations and different topics, especially in a minority population. So very good, all good stuff.
Actually, I just want to say a few last words on this. We didn't quite talk about this today, but when you're doing public health work, it's important to think about social determinants of health, right? And going upstream. Obviously, mental health is an important thing to talk about, but obviously that's impacted by who we are, where we're evolving, where and our personal and community histories as well. So I just wanted to make a quick mention of that, and maybe in our later discussions, that's something that we can get more into.
Thank you for bringing that up. No, that's all we talk about in my work life, SDOH, and how can we access the data and incorporate it into our everyday process so that we're very mindful of it. So if folks would like to reach out to you directly, how can folks get in touch with you?
I would invite you to check out my LinkedIn page, Max Derenoncourt, and send me a message if you would like me to provide you with some consulting work. I can also provide you with a link to my company's website. And if you're interested in working together, I'm happy to entertain this discussion.
Beautiful. Thank you so much. Also, at the bottom of the info page for this talk, I will have all of Dr. Derenoncourt's information, the links, and whatever he'd like to provide for folks to reach out to him, and you'll be able to access the recording of this talk. So thank you so much for joining me today. And I really look forward to having you back on the show and continuing this discussion.
Absolutely. Thank you.
Until next time, I encourage you to stay mindful of the data you have access to and really leverage your small data to drive quality improvement, improve services, and services to the populations you serve. Until next time, thank you so much. Have a great day. This episode is brought to you by Effective Information Management Assistance, specializing in healthcare small data and offering expertise that goes beyond technology. Visit www.eima-inc.com to learn more about Emma and the podcast, Let's Talk Small Data.